Hello everyone, welcome to 292 Baby Educational Videos. My name is Jim Coffey. I'm a communication professor here at Monroe Community College and the founder of 292 Baby. If you haven't heard of 292 Baby before, it's community colleges. That's our outreach to help support parents and caregivers, anyone who takes care of our youngest children and babies. We produce educational videos, and it's on topics that are of interest to people who care for young children. Today's topic is a special one. It's called Centering Pregnancy, and it's for anybody who's interested in early childhood, who is pregnant, knows someone who is pregnant, who plans to become pregnant. It's a topic of utmost importance to you. 292 Baby is also a telephone number. You can call 292-2229 from 7 in the morning till midnight, 7 days a week, and talk free to a registered nurse about anything non-emergency in your baby. And our nurses love talking babies, so please don't hesitate to call. We've produced over 100 educational videos, and they can be found on our website, which is www.292baby.org. So, with no further ado, let me introduce our special guests. And from my left to right, we have Rebecca Alley. And Rebecca, thank you for coming. Rebecca is a registered nurse with Rochester Regional Health. And next to her, we have Brittany Brady. And Brittany is due in 3 weeks. So thank you so much for coming, Brittany. And she has also experienced she has 2 children, or about to have your second, but your first child, you did not go through centering pregnancy, so we'll be able to compare, and you have this time. And we also have Alexis Buchholz, and Alexis has also 2 children, one that you did go through centering pregnancy, this latest one, 5 months old?
Yes.
And then your previous one, you did not go through it.
No.
So, okay, for starters then, I think what we'd like to do is actually learn about centering pregnancy, and so we'll go to you, Rebecca, and can you start us off? What is it for somebody who's never heard of it before?
Sure. So centering pregnancy is an evidence-based form of prenatal care. A lot of people make the assumption that when they hear centering that it's a class. It is not a class. It's actually a transformational way of delivering prenatal care to women. So starting at 16 weeks, women actually attend group care where they are with other women of similar gestational ages, where they have lots of education and conversation around different topics relating to their pregnancy, have the opportunity to ask lots of questions and learn lots of information. And even if they're not comfortable asking questions, they have the opportunity to hear what the other women are going through and learn through them. They also see their provider during that time, so they're actually within the same space but in a separate area of the room, actually have their belly check. So for any woman who's been pregnant, you know that they measure the height of your uterus with a little tape measure, and they listen to the baby's heart rate, and they ask some questions about how you're feeling and what's going on, and you have that opportunity and actually do that right in the space during centering. So it is not a separate class. It's actually your prenatal care that it's just a different way of receiving that care.
Okay. And how big are the class sizes? Or not class, how big are the sizes of the groups?
So 8 to 12 is really what is recommended. The program was actually developed in the late 80s by a midwife who in the office setting was seeing pregnant women all day long and saying the same thing over and over again. So, you know, first trimester, women would come in talking about round ligament pain, and she would have the same conversation with these women over and over all day and never really have the time to have the conversation she wanted to have about other things, and decided there had to be a different way. So she developed Centering Pregnancy. Through the 90s, centering really sort of took off in terms of research, and so several colleges actually did a lot of research around the program, fine-tuned it, tweaked it, pulled out things that didn't seem to be beneficial, and really isolated the pieces that demonstrated to have improved outcomes associated with them, and has turned centering pregnancy into what it is today.
So this has kind of been evolving over the last 20 years or so. Okay.
So it has now shown to do lots of wonderful things, but some of them are decreased preterm delivery rates by up to 33%, and some of the studies have a higher rate of moms who successfully breastfeed after delivery. Babies who are born from a mom in centering are on average a pound heavier than
That's huge. All of those points are really big points,
and increased provider and patient satisfaction. So patients love the program and providers love the program because we want to have the opportunity to educate women. We want to have the opportunity to get to know our patients. And in a 10-minute office visit one-on-one, you just can't do that these days.
Yeah. When you say provider, are you talking about the OBGYN?
So we have various types of providers who do centering. So we have lots of midwives in Rochester, and so a lot of our midwives do centering pregnancy groups. We also have mid-level advanced practice providers, mid-level providers who do centering pregnancy. So that could be a nurse practitioner or a PA, and then we do have physicians who do centering as well. So one of the things that we're really looking at developing is actually in the works at one of the women's center sites at Portland is actually the development of a high-risk pregnancy group that will be run by our perinatologist, so a high-risk pregnancy doc, so that women with things like chronic hypertension or pregnancy-induced hypertension, gestational diabetes, all those sorts of conditions have been proven in other settings outside of pregnancy to do very well in group care. We will be able to apply that to the pregnancy setting.
Yeah. Intuitively, the idea of being in a group as you go through this experience, because it's got to be, I can't imagine going through pregnancy if you're going to but just going through what an intense experience in your life, and to actually share that with a handful of other people who are going through the same thing. Is it that closeness? Why the results? I mean,
centering pregnancy has demonstrated these results for all different types of women, but in Rochester, the real motivator to implement centering was that we actually have a very poor prenatal outcomes. Many people don't know that, but our preterm birth rate in Rochester is much higher than the state average. In particular, there's a 9 zip code area in Rochester known as the Crescent that overall has difficulties in many types of outcomes. There's on average a lower economic status, lower education status. There is higher crime rate. But in terms of the pregnancy piece, it also, if you're an African American woman living in one of those 9 zip codes, just by the nature of those 2 factors, you're 4 times more likely to have a preterm baby. You're also 4 times more likely for your baby to die in the first year of life.
4 times more likely.
4 times more likely.
This is in Rochester.
In Rochester.
Yeah. Okay. So we have concentrated poverty in that one area, with some very unacceptable numbers.
Very unacceptable numbers. Okay. Yes. And those same quality indicators that we're struggling with as a region are the same quality indicators that have shown to do excellent in centering pregnancy. And so we really initially at Rochester Regional wanted to target the practices that were centered in the areas where those women live. And we also then were able to expand it to Newark Wayne as well. So we now have 4 practices through Rochester, 4 employed physician practices at Rochester General who offer centering pregnancy. In 2015, we actually enrolled over 25% of all of our pregnant women in those practices in centering. It was our first complete year of centering, and so that was a huge accomplishment. And the preterm delivery rate for those women was 6 to 8% compared to the Rochester area of 10.2%.
Yeah. Okay.
So a huge difference.
Yeah. So we're just going to wrap up this first segment in just a minute here, but I just wanted to say this. So in that concentrated poverty area, you're stepping up the outreach to get more moms involved in centering pregnancy.
Yeah, so we have other programs in the works that really will fulfill more of the outreach portion. But when women are referred to our practices, we are definitely encouraging all women to participate in centering. We would really like to get to 60% enrollment by year 5 of the program.
Okay.
And so that's where we're going.
Okay. Okay. Well, we're going to take a little break here and a little transition. When we come back, we'll talk to some moms who have experienced this. So we will be right back.
Amazing grace.
Babies' brains don't grow by themselves.
The sound
But when you sing to your baby,
save a wretch
talk to your baby,
me.
and play with your baby,
I once was
his brain cells learn to grow.
but now
So sing to your baby,
I'm
talk to your baby,
but now
play
I
with your
see.
baby.
Hello everyone, welcome back to 292 Baby Educational Videos. Again, I'm Jim Coffey, and we are dealing with centering pregnancy. And we've just had Rebecca Alley from Rochester Regional Health, who's a registered nurse, and tell us what it is. And fortunately, in this next segment, what we're able to do is we've got two moms who've actually experienced centering pregnancy, and we want to talk to them and see what their experience was like. So first up, we have Brittany Brady. And Brittany, thank you so much for joining us, especially since it's very apparent that within 3 weeks, you're due. And we also have Alexis Buchholz, and you've also gone through the centering pregnancy. So let me go to you first, Brittany. You had one child that you did not go through centering pregnancy, and one that you did. Let's start with your experience with centering pregnancy first. What was it like for you?
It was different, just being in a group of ladies, and we were all experiencing the same thing at the same time, and being able to ask questions that somebody else needed to hear the answer to, where they probably wouldn't have thought to ask that question or would have.
Do you feel like you could have asked anything you wanted?
Yeah, I was comfortable, especially being with girls. We're all going through the same thing, so I felt real comfortable.
Yeah, I can imagine that would be a wonderful bonding thing.
Yeah,
you know what I mean.
Yeah.
Okay, so
at the end, we didn't want to leave each other.
Yeah, and are any of those relationships continuing?
Yeah.
Yep. Okay, so people will stay in touch with each other. Okay, and everyone has a baby due right around the same time. Okay, that is a huge experience there. So who runs these group sessions?
With my session, it was Kate Bush and Corinne, and
so are these are nurses?
Yeah,
okay,
nurse.
All right, and they're connected with your provider, right?
Social worker. Yeah.
All right. Okay, and how about you? What was it like for you, the first centering pregnancy, the thing that you went through?
I absolutely loved it. It was great to be, in the same position as everybody else, and I think it was great for the guys too. I brought my boyfriend to every single appointment, and he connected with some of the fathers, and it's really a learning experience for everybody. I mean, even with my second child, it was still more information, and I took a lot away from it. And I think that with me also having my second child, that was a lot to give to the other moms who were first-time moms or didn't have a great support system at home, and it was really wonderful.
Okay, so the impression I'm getting is that both of you strongly recommend centering pregnancy.
Yes.
Okay.
Absolutely.
Yeah.
And I was offered a doula as well for doing the centering, and I made it to 7 or 8 centimeters before I even had gotten needed pain management with her help, and it was great to have that extra resource in the delivery room from the centering program.
For someone not familiar with what a doula is, can you tell us what that is?
My understanding is, she came to one of the appointments with me towards the end, and then she was there when I was delivering. She, did different techniques, helped me walk in the hallways, rubbed my back, made sure I was comfortable, and helped. And she stayed right up until I delivered, and was there a little bit afterwards, and it was great.
Okay, and the doula is not connected to centering pregnancy, is that correct?
No, but it's offered, at least through my time when I went, through the centering program for free for moms who do the centering program.
Okay. Now you both have had a pregnancy where you didn't do centering pregnancy and one where you did. How would you compare it? Let me come back to you, Brittany. How would you compare the two experiences?
So, with the centering, you have more people to talk to, and I don't know. With the first pregnancy, I'll just go to my appointments. They'll check. They'll measure my stomach, and I might have forgot to ask her a question, or it'll just be a quick appointment. Where with the centering, I enjoyed sitting there, communicating with the ladies, and learning more about each phase, each step of pregnancy. Every time I learned something new, every time I went there. Even though I had my first baby, and I learned that with that baby also, but not in the doctor's office, I did it. So it was just a better experience that way.
So if you start at 16 weeks, you have almost 6 months that you're meeting with these. And how often did you meet?
Once a month.
Yeah, it started, I think, once a month, then every
And then
2 weeks.
towards the end it got closer,
How often toward the end?
Every 2 weeks, and did we
every
get
2
to a
weeks,
week?
Okay.
I think when we were at our weekly checks, we went back to the in office
Because I'm still
we
in
were-
it actually, so I'm going, well, not
Yeah.
centering, but I have to go every week now,
All right.
starting.
And you mentioned that you brought your boyfriend, so men are invited to this as well. It
Yes.
isn't just for the moms. Okay.
Yeah.
They learn a lot.
Anybody who is going to be there for a birthing coach or a support system for you. I mean, my group, we had one of the girls' father. He was there, so the grandpa to be came to the appointments and
Okay.
or meetings.
I remember with our kids, we went to birthing classes, and we actually bonded with some of those folks too. But the birthing classes are different than this.
Yes.
And does the Centering Pregnancy, does that include the birthing classes?
So we do encourage women to take birthing classes supplemental to Centering Pregnancy. They do talk a lot about labor and delivery process. Do you feel like you're more prepared going in for this delivery than your
Yes.
first delivery, or do you feel the same, or?
I feel more prepared. We went and viewed the delivery room and the jacuzzi. I didn't know anything about the jacuzzi the first time, so yeah, we went and viewed that, and like literally we discussed every part of like what to experience, what's gonna come. So, yeah, I do feel more prepared this time.
So from a timing, I mean, it just makes sense. So if you have, for traditional prenatal care, you stand in line, you check in, you sit down, you wait 30 minutes, you're brought back, you see a nurse for a minute, you see a provider for 10 minutes, and then you go. With centering, from 16 weeks through 36 weeks, you're with a healthcare person for the 2 hours that you're in the office for the entire time. So it's not that you're necessarily there any longer, because by the time you do all those other things, it takes about the same amount of time. It's just you're engaged in doing something, learning about your body, your baby, how to care for your baby the entire time you're there in the centering program.
So much more productive use of the time
Yes.
while you're there. Okay, did you ladies find that?
Oh yeah.
You engaged right from the start?
Yeah, and if there was like a question that you were uncomfortable asking at the group, you had that time alone, with the midwife, or you could even wait until after everybody left or come a little bit early. So you still had that privacy in the group.
They'll bring that up in the group, like not to put you on front, but just to say, okay, and how do everybody else feel about this specific, situation?
Yeah.
And you'll hear everybody's opinion, and it's helpful.
Yep. Now, in any group work, it takes time to build trust, and it sounds like you all built trust.
Oh, towards the end, I mean, you talked about anything and over the moon, trust me, like things that you wouldn't just walk up to a person and be like, hey, I got this going on. And like, oh, me too.
Yeah. So you found other people were experiencing the same things.
Yes.
And that helped the bond?
Oh, yes.
And the trust?
Tremendously.
How long did it take to develop the trust?
I'd say like maybe 1 or 2, maybe 3 at the most for some people.
Yeah.
Yep, some people, like, by the 3rd visit, whoever wasn't interested, they probably wouldn't be there. So now this is your true group by the 3rd and 4th visit, and everybody's comfortable with speaking their mind and knowing that we're all here for the same thing, so it's comfortable.
And we have had moms in groups that aren't necessarily comfortable speaking, and that's totally fine too, because if you're more reserved or you feel uncomfortable speaking in a group setting, you still get the opportunity to learn from what the other women are talking about.
Yeah.
The advantage for those women is oftentimes they're also uncomfortable asking the provider those questions one-on-one as well.
Sure.
So they would just never get their question answered.
Yeah.
Odds are one of the other women are going to ask it while you're in group, and so that woman is still going to get that information without ever having to ask that question.
Yeah.
Yep.
Okay.
Yep.
So you found that to be true?
Yeah.
Yes.
Oh, yeah.
So, like, what's an example of a question somebody would be embarrassed to ask?
Loss of sex drive. I mean, that was a big thing for me and my boyfriend at the time, and I found out that a lot of other moms were experiencing the same thing.
Yeah.
And it was kind of comforting to know that, it wasn't just us, because the other fathers were experiencing it as well. And never would you just be able to be like, hey.
So the other fathers were losing their sex drive as well?
Well, I mean, they probably weren't losing it as much, but just, you get to that point where you're like, get away from me. And
Yeah.
then, they kind of feel like, well,
Yeah.
what are we doing wrong? And
Yeah.
it's not them, and it's
Yeah.
just part of the thing. Some
Yeah.
people don't. Some people get an increased one, and
Yeah.
it's
So if a man is attending and he finds out that the moms are losing a sex drive, they're less likely to take it personally.
Yeah, I think
And
so.
that would help the relationship, which
Oh, yeah.
eventually helps the whole process then.
And the more he was informed, the better it was for us, because he could take things home and help me. And like with the first one, he never understood. And then when he saw that other people were going through the same things,
Okay.
it was more comfortable for both of us.
Okay, we're going to take another break here, but when we come back, I want to hear more about the personal experiences that you've had. So we will be right back.
Babies' brains don't grow by themselves. But when you sing to your baby, talk to your baby, and play with your baby, her brain cells learn to grow.
manita, qué bonita.
So sing to your
es.
baby.
Qué linda manita.
Talk to your baby.
Tiene bebé.
Play
Qué
with your baby.
linda manita, qué bonita.
Hello everyone, welcome back to 292 Baby Educational Videos. We are talking centering pregnancy with Rebecca and Brittany and Alexis. And I want to pick up our conversation where we left off, and if I can go to you ladies again. You know, we know the benefits of breastfeeding, and there's a lot of stigma and things that get in the way of people actually breastfeeding. Does the centering pregnancy, given that you're with a group of moms and you can discuss this, does that help you deal with the challenge of breastfeeding?
Absolutely.
Yeah.
Yeah, and it actually encourages other women to want to, because I breastfed with my first baby. So they asked me a lot of questions, and I guess my answers made them more comfortable, because people would tell them it hurt or it doesn't latch, right? You know, like, so like, and I let them know, like, it's really simple, and you know, like in different ways that I tried it and did it, and how long I did it for. Like, I'm still nursing now, so
Yeah.
yeah, it was really cool.
Okay.
They got a lot.
And how was your
Yeah.
experience?
It was, you know, great. I think there was a couple moms who were totally against it at the beginning, and then by the end they're like, well, we might just try it for, you know, the first couple days and, you know, see how it goes. And there was a lot of people who had that, you know, oh, it's going to hurt, you know, this isn't going to work out right, it's too much work. And I'm like, hey, it's so much easier, you know, and it took a lot from it. Yeah.
It's like $1,200
Yeah.
a
Yeah.
year.
Oh, yeah.
You don't pay for the
Yeah.
food.
Yep.
So, and I know that it was different when my wife was breastfeeding, because it was just so quick. You don't have to heat anything up,
Yeah.
and it's just
They're
there,
like,
and it's
oh,
so good
it's
for the
so
baby.
time consuming. And I'm like, how? I don't have to wake
Yeah.
up in the middle of the night and go get a bottle.
Yeah.
I just nurse,
Yeah.
roll over.
The thing I'm interested in, though, is in the group, you got 10, 12 people, you're supporting each other, you're exploring this, because there are social stigmas, things that get in the way, right?
Yeah.
People insult you if you breastfeed, but that group does help you to
Yep, it
change
encourages
attitudes,
you.
let's say.
Yeah.
Yeah. When you said that there were moms that were against it, were they giving reasons why?
You know, just because, oh, I was having a boy, it's wrong for a boy to be nursing.
really? Okay.
And
All right.
I had a couple of those, and I was like, well, you know, think about before there was formula. What did we do? I
Yeah.
mean,
Yeah.
it's
Well,
completely natural.
In most of the world, too.
Yeah.
Sorry.
It's no, it's okay. It's healthier. Like, it prevents a lot. Like, for you, it prevents breast cancer, or well, helps with breast
Yeah.
cancer.
Okay.
And for the baby, like, they're less sick. They get less sick. Like, you know, so
Yeah.
it's great. And that was what I you know, told some of the ladies in my group that
Yeah.
that you know, my baby was less sick and he developed faster, and it was really.
So this is another opportunity of how dealing with some of those sensitive questions in a group setting, you're getting support from other people, and that would
Yeah.
encourage.
And from experience, not
Yeah.
just someone telling you, well, statistics say,
Yeah.
and,
Yeah.
you know, well,
Yeah.
this should be done this way. And
Now, the
there's
topics that you
experience.
talk about, are they brought by the providers, or is that generated by your own discussions?
Both.
Yeah, I think at the beginning we did like a board and, you know, things that we wanted to go over, things that they had planned throughout for, you know, the milestones, things that were appropriate for where we were at and
Yeah.
all of that.
Okay.
And games and stuff.
Sorry?
We played games and different ways to get people to interact and see if they.
Yeah.
Yeah. Good.
Yeah, so there are some scheduled, there are recommended or scheduled topics. We do try to make sure we cover all of those. But centering, one of the fidelity points is that it's facilitated discussion. So every group's a little different. So if you have, for example, in our Newark Wayne setting, 30% of pregnant moms smoke. In Newark Wayne hospital deliveries.
Wow.
And so if we have a group who has a lot of moms who are smoking, we're going to spend a lot of time talking about smoking cessation with, or helping them have a conversation about smoking cessation, versus a group that has no moms in it that are smoking during pregnancy.
Yeah.
Another great topic that we get a lot more time to discuss during centering is contraception, and I don't know what your
Yeah.
talks looks like,
Yep.
but you get a lot more information, and your partners get a lot more information about what choice you're going to make as a couple after delivery to do family planning.
Yeah. Yeah.
and great experiences in group with that.
Okay, now both of you kind of lit up when she said that. So was that a topic that did come up,
Yeah.
contraception afterwards? And
Both of my babies were not planned, and after this one, we had a plan so that there
Yeah.
was prevention.
I'm still thinking of my plan, but yep, we
That's
we
how it
talked
was.
about it.
yeah,
Would you say you feel more educated this time about
Yeah.
your options?
Yeah, because they
There are
showed me
options.
each option and like literally show me each little piece, like you go in there.
Mm-hmm.
So like, and the thing for your arm and how big it is and stuff. So I was,
Well,
I'm thinking about
you think
them.
about the different options?
yeah.
The great thing about centering is opposed to traditional care, where as a provider we walk in and we assume you don't know anything. Centering makes the assumption that women know things. And so
Shocking.
it's shocking, right? So when you pull a group of women together, you can do some facilitated exercises that really help pull that information out. So you may have, cards on the floor and say, go to the method that you think you're going to that you were on when before you conceived, and you'll have all your women go. And if a woman is on a pill and is pregnant, by the pill card, you can ask her, were you on the pill at the time you conceived? Talk to us a little bit about that. And she may say, oh, well, I forgot to take a few, and so then you're talking about how anyone who decides to use the pill as a contraceptive method really has to be someone who can diligently take that pill and remember to do that every day. The women are telling each other that.
Yeah.
Same thing with stigmas around IUDs or other devices. The women can talk about their friends, their family, themselves who have used these things, and it's coming from other women.
okay. Now, so far, I mean, I get the whole sense of it, but I love the idea. I think the whole support thing, and I can just see that working really well. And you're dealing with topics during pregnancy. How about topics about after pregnancy, like breastfeeding? Do they prepare you for that as well? Did you feel more confident after you had the baby because of that?
Yeah. More comfortable to be like, okay, it is okay for me to put him down in a safe place and walk away and let him cry for a minute and, not to get so aggravated.
Yeah.
And there was a lot of different methods that you could do different things with
Yeah.
that they gave you. And
I'm guessing they address shaken baby.
oh, yes,
Yeah.
there was
Yeah.
a lot of those major things that they went over, appropriate time, what to give the baby, if it's constipated, Some moms were like, oh, I'm just going to give him prune juice. Like, you can't get an infant prune juice, clearly. But, that's
Yeah.
things that you learn there, and it's
Yeah.
really helpful.
So some of those topics are in those first months after the baby is born.
Yeah.
Okay. And do you wish that, or maybe that the group actually stays connected after the babies are born? Why do you smile? Why do you laugh?
Yeah, because we were a cool group, and we all got each other's number. We wrote our numbers on the chalkboard. Like, okay, so we're all over there putting each of our numbers in our phones and stuff. So, but yeah, I do look forward to afterwards bringing our babies together, letting them meet each other.
Yeah. It actually sounds like you looked forward to the meetings.
Yeah.
Yeah, it was. I mean, it wasn't like, oh, here's another doctor's appointment.
Yeah,
It's
I
like,
gotta
oh,
go
we get
to
to
the
go see the
doctor.
girls and all that.
Yeah. So overall, a really positive experience.
Yes.
Yeah.
Yeah. Would you have any hesitation recommending this centering pregnancy to anybody?
No, I do recommend it. And where I'm actually from, I live about an hour and 10 minutes from,
Your provider?
yeah.
Yeah.
And no one knows about it. They're like, what are you talking about, centering pregnancy? And
Yeah.
my boss, I kept telling her, I'm like, I gotta go, I need an hour for my appointment. Why
Okay.
does your appointment take an hour? And I'm like,
Yeah.
well, because of all this, it's really great.
Yeah. Let me just go down the line. We got just a minute left. Any final thoughts on centering pregnancy?
Don't hesitate to do it. It's great.
Okay. All right.
I recommend it strongly.
Okay. All right.
It's just, I think, in this new climate of healthcare, looking at how we can give better, higher quality care in a more efficient manner, I think centering pregnancy just makes sense.
Yeah.
Women feel supported, patients love it, we have great outcomes, and providers love it as well.
Yeah.
So for me, it made sense as an administrator
Yeah.
to implement centering, and we have these wonderful ladies as a result of that.
Yeah. So, for me, just realizing that all future generations of human beings enter the world through women, right? So to create new opportunities and new options for women seems to be a very smart move for us to make, and this sounds like a really, really good one. So it's just actually getting off the ground, and I think that probably could see it grow tremendously over the next few years, especially
Hopefully,
with those
yes.
recommendations that you have. So, okay. Well, I'd like to thank everyone for joining us today on Centering Pregnancy. Again, I'm Jim Coffey. Coming up on a slide is if you want to know where to access the services of centering, you can call 292-BABY, and the nurses there will be able to direct you to the most appropriate center. Okay? Thank you all for joining us.